Choosing between a normal delivery or vaginal birth and a cesarean section or C-section is a significant decision that many expectant mothers face. This choice can be influenced by medical advice, personal preferences, and individual health circumstances. Each method has its benefits and risks, and understanding these can help you make an informed decision that's right for you and your baby. Here's a comprehensive look at both options: normal delivery or vaginal birth. Benefits. Natural process. Vaginal birth is a natural process that typically involves fewer medical interventions. The body is physiologically designed for childbirth, and in most cases, it's the safest way to deliver a baby. Quicker recovery. Recovery time after a vaginal birth is generally shorter than after a C-section. Most women can leave the hospital within 24 to 48 hours and resume normal activities sooner. Lower risk of complications. Vaginal delivery carries a lower risk of certain complications such as infections, excessive bleeding, and blood clots, which are more common with surgical procedures like a C-section. Immediate bonding. After a vaginal birth, you can often hold and breastfeed your baby immediately, which promotes bonding and helps stimulate milk production. Reduced respiratory issues in babies. Babies born vaginally are less likely to have respiratory problems because the process of passing through the birth canal helps expel fluid from their lungs. Future pregnancies. Vaginal birth does not limit your options for future pregnancies as much as a C-section might, especially regarding the possibility of vaginal births in subsequent pregnancies, vaginal birth after cesarean. Risk. Perineal tearing. Vaginal birth can result in tearing of the perineum, the area between the vagina and the anus, or the need for an episiotomy, a surgical cut made to prevent tearing. Prolonged labor. Labor can be long and physically demanding, which can be exhausting for the mother. In some cases, prolonged labor may necessitate a C-section. Pelvic floor issues. Vaginal delivery can increase the risk of pelvic floor disorders, such as urinary incontinence or pelvic organ prolapse, particularly in women who have had multiple vaginal deliveries. Unpredictability. Vaginal births can be unpredictable. Complications may arise that require an emergency C-section, which can be more stressful than a planned surgical delivery. Caesarean section or C-section. Benefits. Planned and predictable. Scheduled C-section allows for more predictability and planning. This can be reassuring for women who want to avoid the uncertainty of labor. Avoids labor pain. Since C-sections are performed under anesthesia, they avoid the pain and physical demands of labor and delivery. Reduced risk of birth injuries. C-sections can reduce the risk of birth injuries, such as shoulder dystocia, when a baby's shoulders get stuck during birth, especially in cases of large babies or other complicating factors. Control over timing. A C-section allows for greater control over the timing of delivery, which can be important for women with certain medical conditions or those with a previous complicated delivery. Preservation of pelvic floor. C-sections may reduce the risk of pelvic floor disorders associated with vaginal birth, such as urinary incontinence and pelvic organ prolapse. Risk. Longer recovery time. Recovery after a C-section is generally longer than after a vaginal birth, with a hospital stay of 3 to 4 days and restrictions on physical activity for several weeks. Surgical risks. As with any surgery, C-sections carry risks such as infections, excessive bleeding, blood clots, and reactions to anesthesia. Respiratory issues in babies. Babies born via C-section may have a higher risk of respiratory problems since they do not pass through the birth canal, where fluid is expelled from the lungs. Future pregnancy complications. C-sections increase the risk of complications in future pregnancies, such as placental problems, placenta previa or placenta accreta, and uterine rupture, particularly if multiple C-sections are performed. Emotional and psychological impact. Some women may feel disappointed or distressed if they were hoping for a vaginal birth but needed a C-section. Postpartum depression may also be more common after a C-section. Which is right for you? Considerations. Medical advice. Your healthcare provider's recommendations should play a key role in your decision. Certain medical conditions or pregnancy complications, such as placenta previa, breech position, or multiple births, may make a C-section the safer option. Personal preferences. Consider your feelings and preferences regarding childbirth. Some women prefer the predictability of a C-section, while others value the natural process of vaginal birth. Previous birth experience. Your previous birth experiences, including any complications, can influence your decision. For example, women who have had a traumatic vaginal birth may opt for a C-section, while others may want to try for a VBAC. Support system. Consider the support you'll have postpartum. A C-section requires more recovery time and assistance with daily activities, so having a strong support system is crucial. Health of mother and baby. Ultimately, the health and safety of both mother and baby are the top priorities. If complications arise, your healthcare provider may recommend a C-section, even if you initially planned for a vaginal birth. Conclusion. Both vaginal birth and C-sections have their advantages and disadvantages. The best choice for you depends on your health, the health of your baby, your personal preferences, and your previous birth experiences. It's essential to discuss your options thoroughly with your healthcare provider to make an informed decision that aligns with your needs and circumstances. Whatever method you choose, the goal is a safe delivery and a healthy mother and baby.